Surprise medical bills have troubled Americans for years, and as COVID-19 spreads, lawmakers try to seek remedies. About 1 in 5 elective surgeries result in surprise bills. A study of 347,356 elective surgeries found that 20% of insured patients received unexpected bills even though they chose in-network primary surgeons and facilities. It said surprise charges can occur if patients choose in-network surgeons and hospitals but receive out-of-network bills from other involved clinicians. Insurance plans often allow considerably higher charges by providers outside of their preferred networks. Surprise bills also come from emergency and inpatient care. In roughly 1 of every 6 emergency room visits and inpatient hospital stays in 2017, patients came home with at least one out-of-network medical bill. 18% of all emergency visits and 16% of in-network hospital stays had at least one out-of-network charge, leaving patients at risk for surprise medical bills. Surprise bills vary greatly state to state. For instance, emergency care visits were more likely to result in at least one out-of-network charge in Texas, New Mexico, New York, California, and Kansas, and less likely in Minnesota, South Dakota, Nebraska, Alabama, and Mississippi, it said. Several states have passed laws trying to address the problem. However, because of limits imposed by federal law, people with larger employer coverage generally are not protected by state surprise billing laws if their plan is self-insured. Doctors send more surprise bills than do hospitals. Inpatient surprise bills can occur because the doctors who work in the hospitals often do not work for the hospitals. Rather, they bill patients separately and may not participate in the same health plan networks that cover the in-network facility. A bipartisan bill co-sponsored by Senator Bill Cassidy, a physician, would limit such charges on several fronts. For emergency care, it would ensure that a patient is only required to pay the in-network cost-sharing amount required by their health plan for emergency services, regardless of them being treated at an out-of-network facility or by an out-of-network provider. Also, it would protect patients who require additional healthcare services after receiving emergency care at an out-of-network facility, but cannot be moved without medical transport from the out-of-network facility. For a non-emergency care performed by an out-of-network provider at an in-network facility, the legislation would ensure that patients owe no more than their in-network cost sharing in the case of a non-emergency service that is provided by an out-of-network provider at an in-network facility.